how do you decide whether you should do IVF or ICSI, or alternatively, can you do a split of IVF and ICSI?
Yes, so you decide in two different stages. So first is if patient if the couple are having IVF cycle for first time, you go by baseline parameters, parameters of sperm parameters. So if semen analysis is normal, so let us say concentration is normal, motility is normal, and morphology, which means for how sperm look normal, then IVF is best method. So, and if sperm parameters abnormal, especially if total sperm count is less than 5 million, so then that indicates ICSI is best method. Generally, you go by sperm parameters in the first cycle. So in repeated IVF cycle, let us say you did IVF, so fertilization rate should be approximately 75% of mature eggs. So if you had a low fertilization, that indicates that with IVF you had a low fertilization. Probably if a couple need another cycle of IVF, then you should consider doing ICSI. So fertilization level can be normal, which is let us say you have a 10 mature eggs, then 8 fertilized, that's normal. If 6 fertilized, that's low. So which means 75% or more is normal, 75 to 50% is low, less than 50% is very low, and if none of the eggs, mature eggs fertilized, that's called failed fertilization. If you, with IVF, if you have a low or failed fertilization, yes, of course, you need to do ICSI next time and next IVF cycle. So, and yeah, and also you can plan for IVF. On the day, if produced sperm concentration is so low, then you have to convert to ICSI, because simply you don't achieve good fertilization with IVF because there isn't sufficient amount of motile healthy sperm in that sample. So in some couples, it's hard to decide whether we should do IVF or ICSI. In these couples, we decide to split into two: 50% of eggs inseminated with IVF, 50% eggs inseminated by ICSI. Let us say you do egg collection and then you get 10 eggs. Arbitrarily, you just inseminate 5 of those eggs with ICSI, and remaining 5 you leave with IVF. Then you next day you find out which actually method was best for this couple, comparing these two arms, two groups. So you do that usually in patients who have a long-standing history of unexplained infertility. Let us say you can't see any reason, but couple have been trying for many years, like 3-4 years, without successful pregnancy. Here you suspect they may have anti-sperm antibody. Maybe the female patient is producing egg is producing antibody against their partner's sperm, or the partner's sperm may be producing antibody against their own sperm. So this may be resulting in failed fertilization when they're trying to conceive naturally, and you suspect they may have some interaction between, the problem is interaction between egg and sperm. Here you want to give a benefit of ICSI, otherwise they may have a failed fertilization. So at the same time, you want to give a benefit of IVF. Why? Because like we said, IVF gives you biological selection, better selection of sperm, and better maturation of eggs. In this case, you have to give a benefit of IVF, where you can split and do half IVF, half ICSI. And also we do half IVF and half ICSI. In couples, we can't tell which actually method is the most optimal. They can do a number of cycles. They may have a poor fertilization with IVF and poor fertilization with ICSI. Occasionally we can't tell, and we want to give a benefit of both IVF and ICSI. So benefit of ICSI is you have a more control. You can put the sperm into the egg, and you reduce the risk of low fertilization or failed fertilization. Benefit of IVF, like we said, egg is selecting sperm, you are likely to select better quality sperm and likely to have a better development of high-grade embryos. So, and this is why we split. We don't do very often, in very small group of couples, we split into two, 50% IVF, 50% ICSI.